I was just talking to my roommate, and I'm going to repeat. One of the problems I was explaining to him is how psychiatrists like overprescribing people meds, and then people of my generation that was born in the 80s and 90s are brainwashed into just taking and drugging themselves. I've seen this many, many times in the homeless communities or in the disabled communities or people that were born in orphanages.
Mm.
I'll give you an example. There is a lady I know who was 47 when I was only in my 20s, and she was hitting on me all the time. Now, I never dated her or anything like that, but she used to have a good stock of medications. And whenever I needed a muscle relaxer, she was the first person to yell, "You need one? You need one? You need one?" all the time. Like, no, no, thank you, thank you. Yeah, I just had a seizure last week. You know what? I really could use one just in case I come back. Stuff like that. Muscle relaxers aren't the best thing for that, but if I get hurt, the next day they do help with the pain from the bruises and from the seizures. Anyway, so this lady, I asked her, I said, you take 5 meds at night, three in the morning, three in the afternoon. Are they helping you? She goes, "Oh, yeah, I've been on these meds for 30 years." And I go, "Well, aren't these all from a psychiatrist?" I go, "These are muscle relaxers. They're controlled substances. There's Xanax. You got Seroquel. You got Trazodone. You got a bunch of controlled substances here. And I know you say you need them, but you're getting high off the Ativan and selling it. You're giving away the muscle relaxers, and you're taking the rest for sleep, right?" She goes, "Yeah." I go, "Okay, so what do you need what does the doctor think you need? How are these helping you?" She goes, "Oh, I sleep better." I go, "You're taking 3 meds in the morning, 3 meds at night, and three in the morning, three in the afternoon, and five at night just for sleep? Just because you can't sleep? That's all?" She goes, "Yeah, I just told the doctor I can't sleep, and he gave me all this." I'm like, "He's giving you Xanax in the morning and afternoon. He's giving you controlled substances. He's giving you a cocktail of Xanax, Trazodone, and Seroquel with two other meds like a muscle relaxer at nighttime. And he's telling you that you need these medicines." He goes, "Yeah." He says, "I need these medicines and I shouldn't stop taking them." So this is your psych doctor, right? I asked her a simple question, and she realized maybe she should look into this more with her doctor. But the question I asked her is a question that every parent should ask a psychiatrist when dealing with them with your child. How, you ask your child, how does that med help you? Same thing I asked this lady. She said that those meds were helping her. I asked her, "How are those meds helping you? How do you feel different when you take those meds? What gets better and what gets worse?" Because if they're helping you, then something is getting better. And you know what she answered?
Mm.
Just sleep. She said she falls down. She's having more problems walking. She's having more problems with her stomach. She's gaining weight because she's hungry. She says that she has less impulse control, and thanks to all the Xanax, she's stealing off the shelves, but she can't understand why she's doing it because she never used to steal off the shelves, but ever since she started Xanax, now she can't control herself. Which
Oh.
this is the one I had to apologize at Rite Aid because when you're with me, you don't steal from Rite Aid or any place I have to go back. I don't care what you do, but if you're with me and it's a place I'm going back, no. I'm surprised she listened to me and went back in the store and they let her. I'm surprised that worked out, but Jesus was on my side that day. Anyway, so she's taking 3 morning meds in the morning, 3 meds in the afternoon, and 5 at night just for the benefit of sleep. She could smoke a joint or take a Benadryl and get that same thing accomplished safer. So her psych doctor has put her health at risk to make money because she doesn't even know why she's on these meds.
No.
She's just selling the Xanax for money, taking it to get high, and she's sleeping good. But when you ask her, what are the benefits? What you say these meds help you. How do they help you? She says the only help is sleep, and she has all these downsides bothering her that she's bringing up with the doctor. This is very common with my generation in psychiatrists. It's very common in the 2000s to see parents trying to get psychiatrists to do this to their children and then applying for Social Security. We get a lot of this. I went through it. until I was in my 20s. Doctors, when I complained about heart palpitations, headaches, hangovers, severe symptoms, you know what the psych doctors did for me? They doubled my doses, and my mother made as many fantasies up as possible. My mother would feed fantasies to the psych doctors, and then my psych doctors would feed me dangerous drugs. And I'm not the only one. There are so many people in Massachusetts. That's but the worst state for this. There are more children on drugs in Massachusetts than anywhere else I ever saw. Dangerous amphetamines, benzos, opiates, all different types of shit. And I mean, I was 7 years old when I experienced my first overdose, or my only real overdose. And you know what it really was from? My mother and the psychiatrist. Yep, a mixture of bad doctors and a psycho mother equal permanent damage to your nervous system or death. And that's why I want people to pay attention. If you're taking a medication or giving a medication to your child, you should be seeing an improvement, and your child should be saying, wow, that's better. Oh, I'm sleeping so much better. Oh, my nervous system feels better. Oh, it's so much easier to control my impulses. Oh, look how much better I am. But if nothing seems to be getting better with your child and you got him on more than one medication, then you need to stop what you're doing, because maybe it's the doctor that's the problem. I see this a lot in society with people drooling on themselves saying, no, my doctor says I need it. Well, how is it helping you? I'm sleeping at night. It's 12 in the afternoon and you're drooling on yourself. Yeah, but he gives me it during the day too. Why does it, how does it help you during the day? I don't know. He just says to do it. Well, you're drooling and you can't hold a job. Are you collecting Social Security for a disability? No, well, I just don't know what to do and it feels nice. Oh, so these meds get you a little stoned? Oh, yeah, Seroquel and Xanax mixed together? Fuck yeah, it's like taking a Percocet. Oh, so that's why you look like you're drooling on yourself in the shelter in 1 in the afternoon. And your doctor says this helps you? Yeah, he says take a Xanax and a Seroquel 3 times a day. And at nighttime, a higher dose. And this is just for sleep. You don't find this helping you in any other ways? Is it violent behavior? Is there anything else you're asking your doctor to help you with? No, just sleep and getting a job. Well, drooling on yourself at 1 in the afternoon might not help you with your job. That was a real conversation I had with somebody before. I just figured he had like a history of violence, and maybe that's why they were drugging him with such serious drugs, but it's hard to say. A lot of them, these people are just selling their pills too, and the doctors are going along with it. So it's hard to say in today's society, but the doctors are definitely drug pushers, and you got to keep that into account.